The AMS 700 MS series penile prosthesis is a fluid-filled device that is implanted entirely within the body and is not visible to others. The prosthesis consists of 4 components connected by tubing: a reservoir, 2 cylinders, and a pump. The reservoir is implanted in the lower abdomen, under the muscle layer, and filled with a sterile saline solution. The 2 cylinders are inserted side by side in the shaft of the penis. The pump, consisting of a pump bulb and a deflation button, is placed in the scrotum. The pump is used to inflate the cylinders by transferring fluid from the reservoir to the cylinders. The pump bulb is the rounded part at the bottom of the pump. The deflation button is just above the bulb on the hard rectangular surface of the pump. How to use the AMS 700 momentary squeeze prosthesis. Inflating the prosthesis. When you squeeze and release the pump bulb, the fluid moves from the reservoir through the pump and into the cylinders. When the cylinders fill with fluid, the penis becomes erect. Step 1. Feel for the pump in your scrotum. Step 2. Grasp the tubing above the deflation block with one hand to hold the pump in place. Step 3. Hold the pump firmly. Some patients find it helpful to stretch the skin tightly over the pump to better visualize the pump bulb. Step 4. Use the thumb and forefinger of your other hand to grasp the rounded pump bulb. Step 5. Your first squeeze should be done quickly and firmly to release and activate the pump. Continue to pump slowly, allowing the pump bulb to refill with fluid. Continue to alternate squeezing and releasing until the cylinders fill with fluid and become erect. A full erection may take as few as 10 or as many as 25 squeezes of the pump bulb, depending on the length of the cylinders. Note: do not squeeze the deflation button while squeezing the pump bulb. Deflating the prosthesis. When you squeeze the deflation button for about 4 seconds, the fluid begins to leave the cylinders and returns to the reservoir. After about 4 seconds, release the deflation button and the cylinders will return to their deflated position. Then the penis becomes soft. Step 1. Feel for the pump in your scrotum. Step 2. Grasp the tubing above the deflation block with one hand to hold the pump in place. Step 3. Some patients find it helpful to stretch the skin tightly over the pump to better visualize the deflation button. Step 4. Locate the raised deflation button on the deflation block. Step 5. To effectively squeeze the deflation button, you must place a thumb and forefinger on opposite sides of the deflation block. Step 6. Squeeze the deflation button for about 4 seconds and then release. The cylinders will continue to deflate and the penis will become soft or flaccid. Note: do not squeeze the pump bulb during deflation. Step 7. After the cylinders have deflated, you may squeeze the penis to make it even more flaccid. What to expect after the procedure? Recovery times vary from patient to patient. You will be able to return to work and everyday activities at the discretion or direction of your urologist. Your doctor will discuss when you will be able to use your device. Most doctors recommend that you wait 4 to 6 weeks before having intercourse. This time allows your incision site to heal and helps your body adapt to your prosthesis. You will probably have an appointment with your doctor during the recovery period to be sure you are healing properly. At your doctor's discretion, you may have additional visits or follow-up from this procedure. After your doctor says you can begin using the device, follow the instructions outlined in this video. During the recovery time and after, take care to avoid trauma to the pelvic or abdominal area. Always keep in mind that you have had a surgical implant and choose your activities wisely. Trauma may damage the prosthesis or the surrounding tissues. Use of injection therapy may also damage the prosthesis. Additionally, your doctor may ask you to take antibiotics before and after any dental or invasive surgical procedure as a precautionary measure to prevent infection. What symptoms may indicate that you should contact your urologist? As with any medical procedure, there is the possibility that signs and symptoms may develop after the procedure. If you experience any of the following, contact your urologist immediately. Any unusual or prolonged pain, redness or rash near the incision or scrotum, swelling near the incision, scrotum, or penis, pus coming from the incision or the head of the penis, fever, or any problems at all with urination. For more information about the AMS 700 MS series penile prostheses, your best resource is your doctor. Your doctor is most familiar with your medical situation and can work with you to make sure you get the best possible results from the penile prosthesis. You can also call the AMS patient liaison at 1-800-328-3881, extension 6261, or visit our website at americanmedicalsystems.com.